We're going to go to Dr. Bridge Bombi. He's been kind enough. He's a cardiologist and owner investor of Bakersfield Heart Hospital, one of the smartest medical minds in our community. Been kind enough to come on to this show every Wednesday this hour to help us walk us through this. Dr. Bombi, how are you, sir?
Richard, I'm very well. You set up the table beautifully. I think those questions are very pertinent. And as we expand on those questions and answers, we have to have a disclaimer that this is not out in the open. You're going to learn. It's like building the plane while you're flying. So let's get one question at a time. Please go ahead.
All right, let's start with the question of the day is how quickly can we put people back to work? I mean, it seems to me you have two issues. You have a medical issue and then you have a political issue. And the political issue is one of a president being pressured by the business community saying, we have to get back to work or we're going to have a wave of bankruptcies like you've never seen. And on the medical side is you don't want to move too quickly because the last thing you want is a resurgence of this virus and yet more infections of death. What should, in your mind, Dr. Bombi, how should we go about this and what might that look like?
So, Richard, from a philosophical standpoint, health is wealth. It's simple, elegant, and self-evident. Health is wealth. So right now what we have adopted is a blunt knife approach, which was necessary to isolate most of us from each other to flatten the curve. But as we don't work, it puts economic pressure. So the way I look at it is there are two wheels, one health, other wealth or economy. Both sustain a social fabric. If either wheel is compromised, there will be consequences on the societal side. That include domestic violence, that includes increased divorce rate, that includes other chaotic consequences. So that's the pressure on everybody's mind. How do we put the train back on the track? How do we address the health issue? The way you approach the health issue is not through urgency, but through efficiency. So you have to use all the tools we have accumulated to our benefit and not to virus's benefit. So another analogy that comes to my mind is when you hike, you see a rattler pass around the corner. Mm-hmm. What do? You measure the strike distance. You see how long the rattler is. So roughly half the distance is the strike distance. So hence the social distancing, the 6 feet distance, isn't a panacea. It's not like the virus will never get you from that distance. Yes, mm-hmm. It can. What it does is it dilutes the dose. And the dose and density are the most significant factors in getting the sickness and amount of sickness. So social distancing is going to be the mainstay of how we open the economy in an incremental manner. There's hygiene, of course. Then all the other tools that include staggered schedules, and I am strong proponent of having 7-day work week, that would give us 2 more days to allow the staggering not to compromise the amount of work and the productivity we can do as a country. Then the other solutions which are going to be very effective are diagnosis of patients who are actively shedding virus and are asymptomatic. So in other words, testing. Testing has to be the mainstay of allowing people to come in and containing the contagion at the same time. If we can test, we really expose ourselves to the hazard of a second and more disturbing tide in the virus's resurgence. Look what happened in Singapore, for instance. They were very capable in testing and tracing, but once the viral infection affected enough people, they had to go back to lockdown. So we don't want to have a second lockdown. Slow, incremental, measure and manage every step of the way.
Dr. Pomig, when you say that the testing is so important, I think we all agree with that, but I'm not sure what that will look like. Are you talking about testing that would be testing for, I'll let you describe it. Would it be testing to be testing to see if you have the antibodies, testing to see if you have the virus? How would that work? And would it be universal testing? Would we all have to be tested?
In an ideal world, so let's just go over the two tests. One is the test to see if a person is actively having an infection. And that test, either PCR-based or ELISA-based, the problem with those tests is the high rate, the sensitivity is low, and we miss a lot of diagnoses. Sometimes a patient is tested 2, 3, 4, 5 times before the diagnosis is confirmed. Yes, we want almost universal testing to make sure we don't have asymptomatic patients infecting others unknowingly. But the problem is, one, availability of the test, two, accuracy of the test. We need to improve those things. Availability has to be universal, and if we can test most people a few times in the next 3-4 weeks, we can essentially control it to the point of eradication. The antibody test is serology test, which is to determine if a patient has had infection. And that has 2 or 3 different ramifications. One, immunity. If a person had an infection, he's likely to be immune. Now, that's an extrapolation based on our experience with other coronaviruses and diseases in general. But not all viruses produce antibodies that are protective. For instance, HIV doesn't produce neutralizing or protective antibodies. So we can come to a conclusion that the immunity will be provided by the antibodies, but more than likely it will be. So one is the immunity component. And second is the epidemiologic component. How many people have been infected? There is a confusion in the scientific minds. What is the asymptomatic infection rate? If asymptomatic infection rate is large, then that's a blessing. Then a lot of the people are infected and have the antibodies that reduces the threat of the virus in general. So
but they can still shed it, though, correct?
No, they cannot. So once infection is over, you have the virus has run its course.
Okay.
But in the process, the body's immune system has created antibodies, and those antibodies hopefully will be protective. Also, the convalescent serum from those patients can be used in other sick people, like it has been used in Ebola and other viral sicknesses. So they become an incredible asset if the antibodies are actually effective against the virus.
Oh, interesting. I mean, so to what degree do we need can we, let me just put it as simply as I can. It sounds to me like you're saying that without testing, we can't put people back to work because to do so would put us at risk. Is it that simple?
It is that simple because if you see, here's the problem. The problem is we know what works. Isolation works, hygiene works, but isolation, maintaining social distance at an industrial scale when people go back to work is an impossibility. People have different attitudes towards virus. Some may have bravado about it. Some may think it's nothing more than flu. Some may not take adequate precautions, but it's something. Attitude has nothing to do with efficacy of the virus or its lethality, right? So it's important when we go back to work, the social distancing has to be enforced through education, through encouragement, and even through fine. But if we can know who are the people who are infected, we can take them away and create an environment at work where all the workers feel safe. With one caveat, the test has to be accurate and timely.
Now, I had heard one of your colleagues or friends, Dr. Himmel Cawthorey, was on TV this morning saying one of the problems with the testing is there's like 50 different tests that test for different things and some more reliable than others. Is that true?
Exactly right. So especially on the antibody side, there are a lot of people who are out there to make a quick buck. let me just expand on the antibody test or the serology test that determines if a person had an infection. I'll give you a case study of Iceland. Iceland is about the size of Bakersfield in population, a little less, 360,000 people, thereabout. So they tested 10% of their population. And they have 1760, somewhere around there, people who are positive after testing 10%. And that really amounts to 0.5%, less than half, or about 0.5% of the population that has positive infection rate. So that would naturally translate into the positive antibodies rate afterwards. So a test to be useful, it has to have what's called 90% sensitivity and 90% specificity, meaning that it has to detect the problem 90% of the times when a patient has a problem. And if patient doesn't have a problem, it shouldn't artificially give the patient a problem 90% of the times. Now, if you extend that thought process to serology or antibody testing, 90+% of the people don't have it. And when the test comes negative, it doesn't really give you anything. So if I'm a scammer, I can easily tell you I have an antibody test for you and give you nothing and charge you $70. So there are a lot of the Los Angeles, I think DA has gone after some people. A lot of tests have mushroomed with the so-called FDA authorization but not approval. So we have to be careful not to buy everything that's promoted out there.
Ah, that's so interesting. As far as testing, would we have to test people, the same people repeatedly? Well, you wouldn't have to test them if they've shown they've got the antibodies and already have it, right?
Right. So that's a winner. If you have positive antibodies, winner. We need to focus on the others.
Okay. Let's move to China. There's been a lot of talk about their lack of transparency. What could have been done? What's your view on that?
I think there's a building frustration among many people that the Chinese needed to do much more, and they haven't done much more. But on the other hand, they have adopted a doctrine of secrecy and lockdown. There is a considerable and meritable opinion or data out there to suggest that the virus didn't come from animals per se. The virus came from a lab, which is 300 yards away from the seafood market, Wuhan viral lab. And it's more than conceivable that they do the bat research, and they work on these viruses. More than likely, it was an accident that the virus was released. And the fact that Chinese have gone out of their way to suppress information in terms of instead of suppressing virus, they have been suppressing information. It lends to questioning. What are you hiding? Did the virus leak from the lab? Did the virus come from bats outside? All of those questions are critically important in understanding this pandemic and preventing the next one. So I share the frustration with the Chinese efforts in concealing. And there is another data that there are probably 2.9 million Chinese who were infected with the virus. And if that's the case, then the extent of transmissibility, they should have closed the airports much sooner. They lack transparency, and they were not helpful. Actually, one could argue if they were helpful, the data says that we would have 95% less infection in the whole world. Now you quantify the economic damage because of that, quantify the loss of life because of that, and ascribe the responsibility to somebody who did it.
Wow, that is stunning. Look, this is the first time I had heard somebody of your stature say that this thing could have come not from that wet market, but from an accident at a Chinese lab that deals with different viruses. So physically, that is near in Wuhan. That is near the wet market. Is that what you said?
That's right. The live animal market, that the lab is 300 yards. It's spitting distance from the market.
I had no idea. Wow, that's right. Well, last question for you, Dr. Brahmi. I'll let you go. What will it take? I think most people are wondering, what do we have to do? What needs to be done where life can kind of almost return to what we used to know as normal?
Vaccine. One word answer, vaccine. Once we have the vaccine, then we can move on. But that's, again, we're talking 10, 12, 18 months. And during that period, we just have to keep doing what we're doing. Hopefully more testing, more antibody testing, and sustained, no relaxation in social distancing. Remember dose and density. You get more dose if you're closer to people.
Oh, wow. And that dose is really important, isn't it? I mean, because is that why so many nurses and doctors are being sick? Because they live in a high dose environment?
Yes, the two things here. One is the amount of dose. Second is continued exposure. Both things add.
Okay, very good. All right. Dr. Bridge-Brahmi, you're terrific. I thank you, sir. I know you're busy. I appreciate you taking time out to come on the show here, sir.
Thank you, Richard.
Okay, thank you very much.